How does having a pineal cyst affect your day-to-day life?
Well, first and foremost, according to doctors, the cyst is not causing any symptoms. So, to answer the question, I guess I'd have to rephrase the question to how does feeling sick like this affect my day-to-day life? And it's different every day. How much energy I have to get things done when I feel like I'm trapped in my body that is constantly in pain. So,
How does mom's pineal cyst make you feel?
Well, it makes me feel sad because I can't always help her, and she's not able to do as many things as she used to because she's in constant pain and she can't drive long distances or anything like that. And it makes me feel bad that I can't do anything to stop it.
You said before that doctors have indicated they feel that your health issues are not being caused by your pineal cyst. How does that make you feel?
well, like many women, I'm sure that can relate, it's frustrating. It's very frustrating. You know, I originally started this journey over 2 years ago. And it's kind of, you know, you're talking to somebody and you ask yourself, if you had this happening, if you felt how I feel on the inside, and we're just normal on the outside, as a, you know, neurosurgeon and neurologist, would these people that you're talking to have the same opinion? And it really is, it's a challenge to not feel as if you're being invalidated or treated like a hypochondriac, or in many cases as a woman, like you have hysteria.
When did this all start and why?
Okay, so it was in November of 2014. I was home pretty much having a normal day, and all of a sudden I started to feel numb and having like muscle spasms or uncontrollable reflexes in my arm. You know, I had numbness in my face, some tingling in my body, and I had what was described to me later as near syncope. But I had no way to tell somebody what the sensations were, except for it felt like effervescence in my brain. And so I went to the emergency room, and it kind of went from there.
What medical treatment and diagnosis have you received?
Well, initially that doctor's appointment, or not the doctor's appointment, but the ER visit, when I went in, I was immediately given lorazepam, which is for anxiety, to calm me down. Mind you, you've seen me, Haley. I wasn't in any way hysterical, or I had some tearing up of the eyes. I was concerned. Of course, anybody that had that happen would be concerned. And I really had to delegate very firmly with the nurse there that I felt as if it was neurological. You know, I have a background, at least somewhat, in an undergraduate degree where I focused on the scientific aspect of psychology and learned a lot about neurology, and I felt it was a neurological issue. That day they gave me a CAT scan and found that there was a pineal cyst that was approximately a centimeter in diameter.
How has the medication been working for you?
I don't know, has it been working? It's hard to tell what is a side effect of the medication or symptom of my illness. I've had on and off issues with my thyroid. I've had really horrible swelling in my feet, not to mention all of the other symptoms I had going through this. Initially, I was diagnosed with epilepsy before an EEG test was even performed. Was told to sign a document that said, you know, I consent that if until a doctor clears me, I can't drive. Luckily, that has never been submitted to New York State. I was put on levetiracetam, which is an AED. A lot of these medications are. It made my teeth bleed. It made me feel like almost an invalid. Once I weaned myself off of that, there was topiramate. I've had issues with depression because when you're in constant pain, eventually it starts to wear at your spirit. I've had issues with sleep, insomnia. My sleep schedule is crazy, you know that. I've really just had migraines that last for 5 to 10 days at a time, and those were horrible. The medication doesn't touch it, but currently, really, it's gabapentin, and my new sleeping aid and antidepressant is amitriptyline. I take magnesium and vitamin D. I take meclizine, which is the antivert for vertigo, so I can go on car rides. So it's hard to tell if the treatment is working. I've been diagnosed with the cyst. I've been diagnosed with migraine with aura. But when I ask the doctors what is causing this, they don't have an answer. All they can tell me is that it's not the cyst.
Do you believe the cyst is causing your debilitating symptoms?
Do you believe it's causing your debilitating symptoms? No. Yes, I do. I really do. I think that it's causing all of it. I think that there are a lot of people out there that may possibly be dealing with a migraine disorder and, really just kind of trust and believe in their doctors as we normally should. I think when it comes to rare diseases, like anything that you've ever seen, if it's not something that's showing on the outside, it is open to public skepticism, and I really think that the medical field and the people who are in it are susceptible to all of that kind of skepticism. If you hear someone say, I've got fibromyalgia, you immediately go, oh, hypochondriac, you're just trying to feed off the system. So this is really an incident of there is something in my brain. It hurts me because it is making things not function properly. My body is telling me that there is something wrong. There are hundreds and hundreds of people out there who have had it removed and feel way better now and have regained their life. And I want to be one of those people. And when I'm done with this, I want to be one of those people that helps the people that may not be informed or may feel that they are alone.
When do you think you'll be able to get rid of the cyst?
Well, initially I wanted to fight the good fight and go through the system and jump through the hoops. But I've got to be after money is raised to perform the surgery. The hospital will not perform the surgery unless you pay it in full. I have talked to them. And the doctor I want to go to charges $6,000 to $8,000 for his surgical skills. And he has great reviews. He's a wonderful man, and a lot of people really look up to him. And I look forward to being one of those people who can come out of it. And I'm not just going to live my life. I am going to spend some of the time that I have making sure that other people don't have to suffer like this just because on the outside everything looks fine.